I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is baby poop. I love talking about poop because parents always call and ask me questions about poop. They often think it's not enough, it's too much, it's the wrong color, it smells funny, so we end up spending a lot of time talking about poop in my office. The truth is that baby poop doesn't look like adult poop. Initially, it starts off really black and stick and thicky. That's what's called meconium. And then as your baby feeds more, the meconium goes away and the stool will turn a brownish color and then a greenish color and then yellowish. And typically, breastfed baby poop is yellow. It might look kind of mustardy, it might have some grains in it, and that's all okay. But once in a while, there may be some variation. I typically say that babies can poop any color of the rainbow. Other than bright red, you should call your pediatrician because that might be blood. If it's chalk white, that can be the sign of a liver problem, so call your pediatrician. Or if it's really dark black after those first few days, then sometimes that can also be a sign of blood coming from higher up in the GI tract. But otherwise, any variation of browns, greens, yellows can be pretty much normal. How often should your baby be pooping? Well, it can vary. A lot of breastfed babies will stool after every feed, but some will only go once every other day. After the first few weeks of age, once you know that your baby's feeding well and stooling well, it's even okay for them to go a few days without pooping. If they seem really uncomfortable, or they're not feeding well, or they're spitting up more, vomiting, then call your pediatrician. Otherwise, give them a day or two and see if it comes out. Now, if your baby's stool is really watery, really runny, really explosive, more frequent than normal, then that may be diarrhea. So again, call your pediatrician and let her check your baby out. We want to make sure that your baby doesn't get dehydrated, as newborns can get very sick very quickly. In general, as long as your baby is feeding well and having at least a few stools a day, that's all good. If you have any questions, bring the dirty diaper in and show it to your pediatrician. I'm Dr. Tanya with Mommy Calls.